Welcome. My name is Sabrina Granis, and I'm an international board certified lactation consultant. I live in Connecticut, and the name of my practice is Nurture by Nature Holistic Lactation. And I've been doing this since 2007, and before that I did peer-to-peer support with families, and started with Legendary actually as a moderator in the Legendary Mamas Facebook group, which is a phenomenal resource. If you haven't checked that out or aren't part of that, definitely recommend that. It's a great place to ask questions and get some feedback from other people who are going through things just like you are, and also from IBCLCs that will chime in on there. And then started doing more work with Legendary Milk in, I think, 2020. And today we're going to be talking all about latching and positioning and your questions around that, some tips and tricks and strategies to help you on your feeding journey. I do want to just, little side note, disclaimer, the goal of tonight is, of course, just sharing information and to try and help you have a more comfortable experience with feeding, answer some questions. But of course, I don't know any of your personal health histories, so can't give really individualized advice. But as I mentioned, the Legendary Mamas group is fantastic. You can also reach out to Legendary Milk. They have a wonderful customer service team that they can help you answer some of those questions as well, or connect you with an IBCLC maybe who's in your area as well. Any product questions, definitely reach out to them. I'm not going to be answering any of those tonight, but you can reach out to them and they are super helpful. So let's talk a little bit about some of the before we get to the questions, just some of the things that you might notice that could point out a latching or feeding difficulty. I know when I'm talking with families, sometimes they'll be experiencing something and it will kind of seem to fade away as time goes on a little bit and looks like things have worked out. But then, another issue will kind of pop up a little bit further down the road in their feeding journey. And then when we're talking and I'm asking about different symptoms or things that they noticed with feeding with their baby, either in the baby or with themselves, a lot of these little yellow flags, I'll call them, kind of pop up. And so it gives us a place to start kind of connecting the dots to find out kind of when things started kind of going off the rails, and also maybe what the cause is, and then how to kind of fix it. I see everybody waving as well. That's awesome. Thank you. I'm glad everybody is here. There's a lot of people coming on, so that's great. So definitely feel free to post questions down below. I will scroll through them after, but we'll get to those as well as the ones that already have come in. So again, kind of looking at sometimes what can be helpful if you're trying to investigate further with what is going on with a feeding challenge is what has been going on since the beginning of that feeding journey. And different challenges can look different for everybody as well. I think that can sometimes make it a little more confusing. But positioning and latching strategies is always a great place to start, because lots of times we can change things up just a little bit or follow some strategies that will get you some immediate comfort, then maybe while you are looking into solving whatever the root cause is if it continues. So some signs that you might see in your baby could be a shallow latch, or them not being able to really open their mouth wide. Some people will mention that their baby has a small mouth. So sometimes we will work on positioning to try and help them have that wider mouth for latching deeply. Suck blisters can be very common, and they can be either on the top or the bottom lips. Sometimes you notice them after your baby will unlatch, that it looks more white on their lips for a moment and then will return in color. Other times there will be more of a suck blister that stays there even in between feeds. If you hear any clicking during nursing or smacking sounds while they're nursing, if your baby falls asleep really, really quickly, that can be a sign that there's maybe some challenges either with the latching or positioning process, or if they kind of fall asleep and they're hungry really soon after having fed. If you notice that they tend to hold their head towards one side, whether it's torticollis or just a preference of side, that can make positioning challenging, or that they really prefer to feed on one side over the other. So sometimes we can make some changes there to make it more comfortable for both you and your baby. Because if it doesn't feel good to feed, of course they're going to kind of pop on and off, which is another thing that you might see. Or if any milk is leaking out of their mouth while they're feeding, either nursing, or sometimes if you notice that with bottle feeding, we can of course adjust that as well. Sometimes it's the type of bottle that's being used, but sometimes it's positioning with that as well. Bottle feeding in and of itself can sometimes contribute to some of the challenges that baby is having. So if we can improve bottle feeding to kind of more similarly match at chest feeding or breastfeeding, that can be helpful and make all the difference in the world for you. Anytime baby is clamping or biting down, or older babies that you're seeing teeth marks, which that relates to one of the questions that we got today that we'll get to. Of course, breast refusal. Sometimes if baby is having lots of hiccups or sneezing, if they're extra gassy, we can look at positioning and latching and see if we can identify some things to address there that will help reduce that for your baby. Or choking, sputtering, or gagging while they're feeding. Of course, low weight gain is an indicator that we may need to look at that latching and positioning situation. And sometimes increase how often we're bringing baby on to nurse or other management issues, but low weight gain is definitely one of those signs or symptoms. Also looking at their elimination patterns, how often they're stooling, what that stooling looks like as well, can give us indicators on what's going on during that feeding. If there are ties, that can definitely impact, or tension in the baby's body. And tension can result from the birth process or how your baby was positioned in utero. Definitely ties can cause tension in the system as well. An irregular suck, swallow, and breathe pattern. So if you notice that your baby is sucking and swallowing, and then they take a big breath, they're having a hard time kind of regulating that pattern. Again, I say always start with positioning and optimize that for a nice deep latch and see where that gets you before we jump into deeper things. And sometimes parents will be experiencing the symptoms, but again, not always. Everybody is different in what they're noticing, depending on your baby's anatomy, your anatomy, how you fit together. But some things that we can address with positioning changes can be any pain that you're having while your baby is nursing, supply issues. Because if we don't have a deep latch, that can definitely contribute to a decreased amount of milk being removed, which is then going to inform the body that milk is left over and to kind of cut back. sore nipples, or if there's a lipstick shape to them or any misshapen, or sometimes there's a crease kind of, let me grab a little, kind of like a crease right across the tip of that nipple, indicates that maybe there's some compression happening. Your baby's kind of cutting off that blood supply, and so we can adjust positioning to see if we can get that deeper latch as well. Of course, any cracked or damage to your nipple, we want to make some adjustments. If you're getting recurrent blebs or plugged ducts, looking at positioning and latch, super duper important for that, or recurrent mastitis, or if you're having soreness in your, oftentimes it's your shoulders, your neck, or sometimes your arm, your wrist, making some position changes so that you're comfortable is really going to be helpful with that. All right, so let's kind of start digging in. I'm going to go through the questions that kind of came in, and I'm noticing some of the questions that are coming in are similar to what we have. So we'll go through these first, and then by all means continue to keep posting comments with questions, and we'll address those as well. So I'll read the question that came in, and then we'll talk about that a little bit. So one of the questions was, breastfeeding pain. Baby has a recessed chin. Can it improve with growth? So this is an interesting question. So a baby's chin is super important in that latching process. And can it change with growth? Well, the jaw is going to be informed to grow in a more come forward and develop based on where your baby's tongue is positioned during rest in that baby's mouth. So that's super important to keep in mind. The tongue resting at the roof of the mouth kind of puts pressure up on that palate. And so it helps the upper palate, this upper jaw, to grow nice and wide, and also kind of comes down, moving away from the nasal cavity, creating lots of space there, which is really helpful for being able to nasal breathe. If that space is a little more squished, then sometimes that airway is a little more restricted when it's developing. So that is one thing. But this upper jaw, when that tongue is resting up in the roof of the mouth and spreading the palate, that also then informs that lower jaw to have a nice wide arch, like where the teeth are going to come in. That chin being kind of retracted back, or a recessed chin, can make latching harder. I'll grab this puppet. I have a few different dolls and props here to kind of help with some of the things that we're talking about. So when we're kind of going to latch baby, if that chin, hopefully I kind of pulled the chin back a little bit. If it's recessed like that, can make it harder for that chin to land, which tells the baby to open wide and come forward. So sometimes making some position changes will be helpful with that. If you, instead of lining your baby up kind of like a bullseye with your nipple, really lower your baby down so that they can kind of come from underneath your breast tissue. Even with the chin recessed, it makes it a little easier for your baby to land their chin, and then you can kind of help them come up and over. They can have a deeper latch. Another thing is the way that you're positioned. If you can kind of slightly recline and use gravity to help hold your baby towards you, that may help with then being able to kind of be coming from underneath and be getting that nice deep latch. But as far as it changing as they grow, if there is tension or tightness, which is kind of what, just pops up a little bit for me when I hear this question,
it isn't going to necessarily change just because they're growing. I would recommend that an IBCLC does an assessment to see what that looks like as far as what's happening in their oral cavity. Is there any tension in other areas of the body? And we mentioned the health history of what was that pregnancy and birth like as well. And your IBCLC might then recommend some body work, and that might then help in combination with the positioning and latching changes address the issue, and nothing further is needed. But they'd really be able to kind of assess that and map out some steps for you to take to help start addressing that. Okay, the next question we got is positions to keep baby awake and engaged during feeding. So first, let's kind of determine why they're sleepy. Definitely if your baby was born early, if there's prematurity involved, that can be harder, a little more challenging as far as baby does tend to be a little more sleepy. Getting skin to skin can be really helpful. So skin to skin really involves, taking your baby down to their diaper and you having minimal or nothing on from your waist up. That stimulation of being skin to skin is going to be really helpful for them to kind of navigate that latching process. Again, having a position where the whole front of their body is really in good contact with your body, so they're getting a lot of input, able to use their reflexes, their innate reflexes that help them with that latching process can be helpful. And we all, also thinking about just what does the rest of that feeding look like? Are they, are they effective at removing milk, or are they kind of falling asleep because that flow isn't fast enough? Babies do like a fast flow of milk, which I know sometimes there's questions about the flow being too fast, and I think we have one coming up actually, so we'll talk about that as well. But sometimes baby falls asleep because they're not getting enough of that flow as well. And there are different tools that you can use that can help with that. One is a tube at the chest, sometimes called a supplemental nursing system. And we have some blogs on Legendary Milk about supplemental nursing systems. We also have latching and positioning blogs. There's a bazillion blogs with tons of information. So that's a great resource as well, I should point out, to check out, is on the Legendary Milk page, and go under blogs and search for whatever topic you're looking for. Tons of great information there. But sometimes those tools, like an SNS for a baby who's sleepy and having a difficult time kind of keeping active at feeding, because it should be an active process for them, not passive. They shouldn't be just relying on your letdown and then falling asleep. That's going to run into some other issues like weight gain issues. Also, again, it's signaling to your body, hey, we don't need that much milk, because milk will be left in your tissue, and so you can run into low supply issues with that. So if we can offer to keep that baby actively feeding while they are there, and kind of figure out what's going on. Maybe we need some oral exercises or body work, or sometimes just a little bit of growth, as we mentioned with prematurity. And so we can kind of sustain that until baby has a little bit more strength and is more effective and efficient at removing milk, and we can kind of wean away from that tube at the breast. But what's nice about that is all the feeding stays at the breast, which is really nice if you would like that option. Bottles can of course be used, but if you're looking to keep those feedings at the breast and keep baby active there, it can be a great tool. Okay, let's see, next question. latch gone wrong at 5 months. How to encourage good latch at this age. So around 4 to 5 months old, your baby gets much more distracted. They don't want to miss a beat about what is going on around them and around in the room. So they can be more distracted because of that. So sometimes that can happen. And if they're moving around a lot, they may be kind of going to a more shallow latch or turning their head and, coming off, which might not feel very comfortable for you. So thinking about some strategies, we could, again, thinking back in time, what has the feeding relationship been the entire time, not just at 5 months or 4 months, but what was the beginning of feeding like as well? Did you have challenges then too? If so, if the root cause of that challenge wasn't addressed, it could be that what you're experiencing now is just a new symptom from a previous issue. So sometimes when there's feeding issues earlier on, a baby will come up with compensations or workarounds. They'll kind of figure it out a bit, figure out, ways that they're going to make it work for them if it's difficult. And so we're like, they figured it out. We're all good to go. Everything is fine. But then later, another symptom pops up. And it isn't really a new symptom. It is just another symptom of that original issue. So we if we're connecting the dots through time, oftentimes we can get some answers about what might be happening. And then, reach out to your IBCLC to kind of go through that with them, as well as your health history, and figure out a plan for moving forward. The nice thing about working with a lactation consultant is you're really going to get that individualized support for exactly what's going on for you and your baby. Otherwise, I will say, of course, there's some general things to try. Great place to start, of course. But then if it isn't really addressing it, getting that individualized help is really going to target exactly what's going on for you and your baby. So another thing, this is why I write notes, because I definitely will start talking and go on tangents. So I want to make sure I give you lots of strategies to try. But another thing that is fabulous at this age is nursing in a sling or carrier that allows for nursing, because then your baby can nurse and you can be walking around, moving around, and they're getting that enjoyment of stimulation and not missing what's going on around them, but still able to nurse. So I have 2 kids. They're grown now. I have a 25-year-old and a 20-year-old. But I do remember those times when they were younger. I think they probably lived in the sling for a few years. It's how we would nurse not only at home, but out and about as well. And it really, really helped kind of keep them actively nursing for a little bit longer during those periods of distraction. One thing I did want to mention is sometimes during that time frame, babies will nurse for shorter periods of time during the day. They might increase their nighttime feeds, and that's perfectly fine, normal, okay to do, because babies are smart. They know removing milk during that time, also during the night, is when your prolactin is at its highest. It peaks overnight. And so when it's already elevated, and then we're also stimulating for prolactin to be released with milk removal, it sets up your milk supply, so it really can be helpful in continuing to maintain your supply during those periods when your baby is more distracted, which again, that distractedness is very developmentally normal. But sometimes it can be a challenge to kind of weed out, is this developmentally normal behavior, or is there something more going on? So an IBCLC could definitely help with that. Okay, next question. All right, I have huge nipples and my baby is having trouble latching on properly. What are some tips? So definitely positioning for a nice deep latch is going to be helpful. It isn't super common, but there are cases where your anatomy, your nipple may be so large that your baby is having a hard time accommodating that, and just, some growth is going to be helpful. There are different strategies that can be used. Again, this is something I would encourage you to reach out to an IBCLC so that you really can get some individualized help with that. But lots of times it's going to have a lot to do with the positioning and the latching. And again, if we're just grabbing another puppet, if we're really focusing, on, instead of having that bullseye situation, kind of bringing baby from underneath, land that chin, which signals the gape reflex, and then you can help your baby forward for a nice deep latch. They may be able to take more of that tissue in their mouth, and that might change that picture for you, even if your nipples are on the larger side. So give that a try. And anybody who's giving some of these things a try, if you want to, write in and let us know how they helped you, that'd be amazing as well. Okay, next question. How much can a lip tie affect latch? It can affect it a lot. The lips help create a seal around the breast. That's why we see the lips kind of flange out and seal on that breast tissue, eliminating air kind of sneaking in. Is when air is swallowed along with breast milk, that's what can cause that digestive upset, more gassiness. It can be a contributor to reflux. And when belly doesn't feel good, it's going to be really hard to continue nursing. So sometimes babies will be popping on and off because of that gassiness, but that it really has more to do with that seal that the lips are supposed to be able to make. I will say it's also really not very common that we see a lip tie and there isn't a tie under the tongue as well. So it's just something to keep in mind and have assessed by an IBCLC. Not all IBCLCs, just like any profession, we all kind of have our different areas that we're very passionate about and get tons of continuing education in. So definitely totally fine to ask your IBCLC or ask around for an IBCLC who's taken lots of education in the area of ties and oral function, an assessment for them, and habilitation after tie release or something, so that you know that you're getting a really good fit, a good match between you and the IBCLC that you're working with. But the lip ties can also affect then the muscles that are being used during feeding. So compensations can be happening and being used because of that tie. And it can also play a role again in how the facial development and oral cavity development progresses as well. So definitely something to have assessed by a lactation consultant, because again, sometimes there can be tension that's contributing in as well, and we can make lots of improvement with some oral exercises, and that you're lactation consultant can give, but again, that's going to have to be individualized. It's not really helpful to go online and ask, oh, what are some good exercises for a lip tie or something, because it affects babies differently. Just like we talked about some of the, signs and symptoms that babies or parents might experience. You notice it was a really long laundry list, and it can be different for everybody. So having a lactation consultant really talk with you about what's going on for you during feeding can be helpful to create that individualized plan. Okay, so this is the last question that I have that came in prior to our live. So we'll address this and then I'll scroll through and answer some questions that came in. So this is, how do I fix a shallow latch? So we've talked a little bit about this, but I like to think about positioning and latching in that there's 3 pieces to this puzzle, right? So there's you, there's your baby, and then there's kind of how the two of you fit together and make things work. So always you need to get, and somebody said, thank you for answering your question. You're welcome. Always you should get comfortable first, because you're going to be putting the baby to your body, right? So you have to be in a really comfortable position first. Also, so that you're able to sustain holding your baby in that position. If you're not, you could be getting a sore neck, shoulders, arm, and that's going to make sustaining that positioning while the whole time that your baby is feeding much harder to do. So I recommend you get comfy first. Part of this is going to be noticing really early feeding cues with your baby so that you kind of catch them when they're just starting to get hungry. Kind of like, if we notice that we're starting to get hungry, we have a little more clear mind to consider what we're going to eat, even how we eat is likely more relaxed than if we wait until we are just starving, right? So crying is a really late feeding cue, and it's much harder to get baby positioned and latched well when they're already upset. So your baby might still even be asleep and just starting to kind of turn their head side to side or put their fists to their mouth or be licking their lips. Those are all early feeding cues and a great time to start getting yourself set up if you're not already nap trapped anyway. But get yourself set up so that you're able to put your baby in a great position for following their reflexes, for latching and getting a nice deep latch. So one position that I do use a lot and that I love is kind of like that koala position. You can even, lean back a little bit. Some people I find do need a pillow behind their lower back if they're going to slightly recline. Because again, if you're sustaining this position for a little while, your lower back might get a little bit sore. Or, and play around with the pillows that you use. I usually do not recommend, pretty much never recommend, but there's always those exceptions. A nursing pillow that's going in front of you, they often just get baby way too high at the chest. I also find that it's hard to bring your baby really in close to your body with those pillows often, because baby's often laying on top of them. So my kind of guideline is pillows to support you that will allow for you to support your baby. Another one that I love is a pillow under your arm, whichever side you're going to be feeding baby on, so that you can really allow your arm to sink into that pillow. Notice, otherwise my shoulder kind of is up if I'm trying to grab my baby here. If I'm trying to, hold my baby in and my arm's not touching anything, if I can relax, notice how it shifts where the baby is. I am doing it exaggerated, but just to be able to show you. If I have my arm up or I'm tense because my baby's crying and upset, either because I waited long or just because there are feeding challenges, But if I relax, that completely changes my baby's position as well. It also, instead of kind of closing me in, makes a nice wide open area for my baby to be able to latch more easily. If you're kind of in this flexed position or leaning forward, which is another thing that I'll see sometimes, or can be an easier fix with positioning, if you're bringing your breast to your baby, you're kind of going into a flexed position yourself and causes a flexed position for your baby, meaning that their chin is more down towards their chest. What we want to see is that chin being able to elevate so that they have some nice space here for opening their mouth nice and wide, getting their tongue out over their bottom gum line, and being able to swallow more comfortably. And you can, the amount of extension that you want to see is just like when, and I do have a glass of water actually, just when you drink from a glass. So about that much. We're not talking like hyperflexion. That's too much, uncomfortable. Just enough that like you would drink from a glass. That's what we want to see with your baby as well. So you can keep that in mind. And you can try it. If you put your chin down to your chest, and you don't even have to, you don't have to exaggerate it. Just your chin down and try opening your mouth. Feel how that feels in your neck. Swallow and feel how it feels versus just a little bit of extension. Opening your mouth, you can open your mouth so much wider. It feels nice and comfortable through your neck. It doesn't hurt. And swallowing is just with so much more ease. So we're kind of going for that. So step one, getting yourself comfortable. Then positioning your baby so that and maybe I'll tilt this down just a little bit. Hopefully you guys can see a little bit better there. I like to have baby straddling your leg. If this is challenging as we go through this, have your baby straddle the opposite leg so that they're kind of leaning like this. Okay, but we can do this side as well. If your baby's a little bit bigger, either you leaning back or their bottom moving further out towards your knee can be helpful. The side that they're going to be latching to, your arm on that side is going to be your guardrail. So they have somewhere to kind of rest the side of their head. And your other hand is your support hand to help bring them forward when they go to latch. And you'll notice that little bit of support on their shoulder blades also helps that chin kind of come forward, which is going to help them land that chin and give a little bit of extension at the neck as well. The baby having their hands free and hugging your breast is where we want to see hands. Again, if your baby's having any tension, sometimes this is with ties as well, but if there's shoulder tension, that might be challenging for them to do. Or if they have a preference of turning their head to one side, it might be challenging to do this on one side, and that's where sometimes having them straddle the opposite leg will help on the more challenging side that they're nursing from. So we go ahead and do that. Again, I'll have a pillow or something under my arm that I really can kind of sink in, let that relax, and putting baby chest to chest, belly to belly, facing my body, their arms up around, hugging my breast. Yes, this koala position can work for newborns. That just popped up. Or is it better for babies with better neck control? No, because you're using gravity in your favor. So this is a great position. As a newborn, doing a more reclined position might be helpful just because it will allow you to kind of lean back and relax a bit as well. But this position is great at any age. Okay, you don't have to wait until your baby is older. Again, we have this guardrail arm, so that is supporting them. Gravity is pulling your baby towards your body, so they are in nice and close, get lots of sensory contact. And the other thing, you just grab we'll grab this one, another demo doll. The next thing that they're going to do, and you can go on to, again, the blogs under Legendary Milk. There's one on building blocks of latching and positioning, kind of outlines this a little bit and gives some more information. And try it out. See how it works. You might struggle a little bit the first couple of times because it's new, right? You're learning it. Totally okay. Babies learn super quick though. So, try it a few times, not just once. With your baby in close, and again, coming from underneath. So we're not bullseyeing, we're not rubbing the nipple here, is often going to signal to kind of slurp the nipple in, and that baby is going to have a more shallow latch, right? So if we kind of drop baby down so that they're coming from underneath the breast, their chest is going to come into your chest. They can land that chin, which says open wide. And then with you supporting behind the shoulder blades, you can help bring them forward. And I'm going to show you with the other puppet as well. I like the bigger mouth on that one. I think it's helpful to see, but I feel like this one offers a little bit different perspective of the same thing. So if we notice, if we position, again, we're in the koala hold, right? I'm just kind of picking the doll up so I can show you. Notice the chest. If we lower baby down, and lower is in the direction of their chin, okay? Lower the baby down, that chest comes forward. So baby's chest is going to come very close into your chest. Then that chin can land, which tells them open wide, and your hand behind their shoulder blades can just help them come forward. Okay? So that can be really helpful. I also love having people practice, either record yourself on the phone or have it in the mode that you can see yourself, or in front of a full length mirror, and practicing when your baby is asleep, when it's not about feeding. That gives you a moment and some time to practice positioning your baby on your body, and you to kind of take a little bit of muscle memory for exactly where is my baby? Is this comfortable? And if you're videoing it, you can kind of see, is baby low enough that then when they go ahead, and this is what requires patience sometimes, when they're nodding their head forward and back, and they're rooting side to side, figuring out where to be latching from, this is where we get sometimes eager, and we just want to help the baby latch. Give them time. Give them a moment. Of course, if they're getting upset, it's okay. Bring them back up. Reset a little bit. No problem. Again, if you've caught those early feeding cues, you kind of bought yourself a little bit of time there as well. But go ahead and kind of position them so that they can come from underneath and latch. So breast is up here, so they can really come from underneath, open their mouth wide, and just the fact, let me turn sideways just a second. If this is the, breast tissue here, just the fact of them tilting their head back makes it such that they aren't going to slurp the nipple in, but they really land that chin. And again, there's a reflex that says open your mouth wide when that chin has contact with your breast tissue. And then your breast tissue helps to kind of add some pressure there, which can help keep that wide open gape, while you then just offer support behind that shoulder, the shoulder blades, to bring your baby nice and close in. Okay? We want to avoid holding the head, because oftentimes babies will go into that flex position, or they are not able to turn their head side to side and do this extension in order to get that chin landed. Okay? So supporting behind the shoulder blades can be really helpful. And again, if we're in a koala position and we have our guardrail arm and our hand back here, they feel nice and stable. They know exactly where they are. They have great contact against your body. Gravity's working with us, especially if we're reclined just a little bit. And so that can also be really, really helpful. Positions that's a little bit more tricky, I find, are positions like cradle or cross-cradle. You're just using the opposite arm because gravity's working against you. Gravity is pulling your baby down and away from you. If I hold baby like this or like this and I let go, baby is going down and away. Versus if I have baby, on my knee or on the other knee and they're leaning towards me, do same knee, and they're leaning towards me, or this knee even, and I'm leaning back slightly, baby's falling into my body because of gravity. So it could really be almost like you have a third hand with gravity instead of trying to manage all of that. And football hold, same thing, kind of challenging, right? That football hold, baby's head is being pulled down towards the floor with gravity. It's almost like I feel it even with the doll. Like I need to kind of hold, I need support on their neck and head area, but that's definitely going to limit the movement that they're going to be able to do for that latching and positioning. One great tool, I already mentioned it, was a carrier or ring sling, one that you can nurse in though. That is such a fantastic tool for being able to kind of, again, play around with it in front of a mirror, drop your baby low enough that they can come from underneath the breast and up and over breast tissue. It's also going to land that nipple, higher in their mouth. So if the nipple is coming in just under the top lip, everything that's on top of their tongue is going to be more areolar tissue, right? So that we have a situation, if my fingertips are the lips, right? Bottom lip is here, the chin landed, bottom lip, and we come up and over. We have a nice deep latch like this, rather than kind of slurping nipple in. If you have any pain, like those first 30 seconds, you're like, ow, 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 ow. Oh, no, it's okay. It literally is because your baby's pinching your nipple in until they get a slightly deeper latch. But it's going to be much more effective if we start with that deep latch in the beginning, and when they nurse, all that areola tissue is cushioning the nipple and you're not going to experience pain. Okay. I'm curious now too, what position were you taught to feed in? And did it change over the course of feeding so far? What position feels best for you right now? Okay. So let's see. Let me just scroll and see what other questions have come in. My daughter got her first teeth. She stopped latching completely. That is a tricky one. So sometimes with teeth, it could be that it's really just, she's really, really sore and having some difficulty. We do have a teething article on the blog, so you might find that helpful. But some things that you can offer, if you take Legendary has a great teether. Actually, it has nubbies on it, and that can kind of soothe the gums. That's great. You could also put it in the freezer. You can try wetting a washcloth, roll it up, pop it in the freezer. Allow your baby to kind of gnaw on that a little bit, help numb those gums a little bit, and then see if latching will happen. If it's a case of breast refusal happening from that, I would try I would contact your IBCLC, but I would try strategies like side lying when your baby is really, really sleepy, like, falling asleep or waking up from a nap when they're still kind of groggy and haven't really come to yet. Oftentimes babies will latch then. Nursing in that sling or carrier that allows you to nurse also can be fantastic. You can do that skin to skin. Co-bathing, so being in a tub together, just make sure that you're doing that safely. that can be fantastic. It can be nice and relaxing. It often takes the pressure off of you as well. And sometimes it's our worrying and anxiety that also creates some anxiety with our baby. So with position, this is a great point. Actually, one thing that I also often have parents do is after they get themselves comfy, they have pillows all set up so that they're comfortable, no body parts are getting sore. I have them put baby on them, kind of positioned. It doesn't need to be total positioning yet, but in that area, and take 3 slow, long, deep breaths. Nice regulated breathing, and you'll notice your baby calms down, your shoulders will relax. Now you can really kind of get your baby in a more comfortable position. It really is amazing when you are nice and calm and regulated. You could be humming a song to them. Maybe you're rocking or bouncing a little bit, adding some rhythmic type movements. That can really help settle your baby down as well, and may make a soothing environment for them to latch. Sometimes when the teeth come in, they're not able to use the compensations they've been using up until now, and now we have teeth marks left on the breast, or it's uncomfortable all of a sudden, or they're not latching. That's definitely a time to reach out to the IBCLC and kind of do that, connecting the dots to see what maybe is happening, and address that. Okay, I'm scrolling through more to see what else. That was the teeth. Go further back. And continue to post questions. If you posted something earlier that I didn't answer so far, I feel like we have covered a bit of positioning and latching. Any tips for doing this position with a nipple shield on? I'm not sure exactly what position, but I'm thinking you're probably talking about koala, since I've been kind of harping on that one. So with nipple shields, one thing is getting that nipple shield on really well. So one thing that you can do, you can moisten it a little bit. You can also kind of invert it a little bit, right? So almost like the nipple is starting to go inward a bit, then center it on your nipple, and then kind of stretch it over your areola. That will help it stay on a little bit more, because sometimes that's the biggest issue, is how am I doing this positioning and latching and using this nipple shield, and the nipple shield keeps falling off anytime you move, or your baby's hand hits it, or their face comes closer to before latching and knocks it off. So having that nipple shield on really well, but also I would venture further and ask, what is the challenge that's happening that is necessary for you to use a nipple shield? And I'm all for using all sorts of tools, nipple shields included, but if a nipple shield continues to be needed, there likely is something else going on that should maybe be addressed. I lost the question. Hold on, let me scroll up. Thoughts on doing a lip tie release if milk transfer and weight gain are normal. So weight gain being normal is just one parameter of how feeding is going, right? We've talked about different signs and symptoms we might see, you experiencing, your baby experiencing. At some point, when there are compensations being built up because of known ties, we're going to run into challenges. We don't know when, we don't know what they're going to be. It may be later on down the road with speech or introduction of solids, or I know I've worked with families before who they were, feeding and everything, and then it wasn't until they started introducing bottles that it was noticed that a tie was really impacting that feeding. So I would talk with your IBCLC, get a lot of education and information about ties and how other ways that they affect oral and facial and airway development and signs and symptoms down the road, so that you feel a little more equipped and informed in order to make that decision for you and your baby. Let me see what time it is. Okay, we're getting close to 7:00, but let me go through and see if we can fit in another question or two. What about if your boobs are on the big side and are lower down for that position? Awesome question. Glad that came up. So let your anatomy hang where it hangs. Then position yourself so that you can position your baby. Sometimes with larger breasts, I find just leaning back is going to be able to kind of, again, we're using gravity, kind of pull your breast tissue back a little bit, and now it's not as big of an issue. And we can kind of just, I know you can't see totally, let me maybe lower this a little bit. So that baby is straddling this leg. I'm really leaned back. I have my guardrail arm to support them. Their arms are up around my chest. And now they can kind of, this is kind of maybe that's good. That has a large breast. But they are then able, if I turn myself a little bit, if I'm leaning back, can kind of come from underneath, because again, that breast tissue is being pulled back by gravity. Okay? So that can be helpful. For some people, I find taking like a receiving blanket or a washcloth, usually not a washcloth, usually like a hand towel, right? Roll that up, prop it underneath your breast, and it will just kind of elevate some of the tissue under here in order for them to be able to land that chin first and you to be able to get a nice latch. I do find it helpful for you to, again, practice in front of a mirror or recording yourself, because that can give you some insight and you can kind of play around with that positioning. Again, if your baby is already fed, then it's not about feeding. It gives you a little bit of time to experiment and explore a little bit, see what things look like, to see if it looks like it's good positioning, to then give a go at it when your baby wakes up for the next feed. Sometimes with a larger breast tissue, depending on where your nipple is hanging, just kind of pressing down on this area of your breast tissue is going to help with that positioning and latching as well. So you can give those a try. Let us know if any of those work for you. And we are at 7:00. So I'm just going to see if there's anything else that maybe we didn't get to. And again, Legendary Milk is fantastic with their customer service team. If you have questions that you want to write to them about, you can always ask that you want some input from an IBCLC as well. I think we answered some of the questions are similar to ones that had been asked prior, so I may not have read them out, but hopefully you feel that they were addressed. Do you recommend, where did that one go? Do you recommend pumping after latching for someone dealing with engorgement? No. And the reason is because then you are bringing all of your milk forward, and if you've already if you've latched your baby and fed your baby and now you're removing more milk, you're signaling for your body to continue to make that larger amount of milk to feed, 1.5 or 2 babies. We want your supply to regulate to just what your baby needs for a feeding. One technique that is fantastic, we're a little over, but one technique that's fantastic, and you can look it up, is called reverse pressure softening. What you're doing is you're using your fingers kind of at the edges of the areola. You're just pressing straight back towards the chest wall and hold for a little while. You will actually feel that milk kind of move back up the ducts. You can then switch your finger position, just press back again towards the chest wall. Wait for a few minutes until that milk moves up the ducts. You will feel that areola softening. That will allow then for your baby to have tissue to grasp. Otherwise, it's almost like if you blow up a balloon or a beach ball way too much, there's no extra play, there's no room, there's nothing to grab. So by pressing in against that breast tissue and moving that milk back up the ducts, we're not removing any excess or extra milk. We're just moving it back further to allow for that areola tissue to be a little softer for your baby to then latch on more easily and for them to then remove milk. So I hope that is helpful. I want to thank everybody for joining this conversation today. I hope that you found the information helpful and that we got to some of the questions that you have regarding latching and positioning. Again, Legendary Milk is fantastic with also being helpful in answering questions, or if you go onto the website and check out all of the blogs and search a topic that is of interest or that you're looking for information on, that's fantastic. And you can always feel free to reach out to me. My name again is Sabrina Granis, and my practice is Nurture by Nature Holistic Lactation out of Connecticut. And thank you again so much for joining tonight. I hope you take care. Bye.